How to treat and cure fibromyalgia. Exercise is a cornerstone of fibromyalgia treatment. As discussed above, the exercise program should include stretching, strengthening, and aerobic exercise. There are no foods that have been shown to improve fibromyalgia. As patients with fibromyalgia frequently suffer from irritable bowel syndrome as well, these patients should avoid foods that aggravate the bowels. A healthy diet of vegetables, fruits, lean protein, and whole grains that is low in sugar and low in processed food and saturated fat can be generally beneficial. Treating fibromyalgia pain, medication options. If you have fibromyalgia pain, hang in there, pain relief is possible. Today doctors have better insight into fibromyalgia, and are using many types of medications to treat its symptoms. Antidepressants, anticonvulsants, narcolepsy drugs, pain relievers, sleep aids. When used to treat fibromyalgia symptoms, these medications alter brain chemistry to help reduce pain, improve sleep, and ease anxiety or depression. Treatment usually includes medication and aerobic exercise, swimming or walking. Symptom-by-symptom approach to treating fibromyalgia. Fibromyalgia pain treatment options. If pain is the primary fibromyalgia symptom, prescribe a prescription pain reliever, an anticonvulsant, or an antidepressant. Anticonvulsants, developed to treat seizures, help relieve many types of pain. Antidepressants are very helpful in relieving fibromyalgia pain and improve deep restorative sleep. They work by balancing serotonin and other brain chemicals involved in pain processing. Selective SNRIs, serotonin and norepinephrine reuptake inhibitors, help relieve fibromyalgia pain, whether the patient is depressed or not. SNRIs include Cymbalta and Effexor. Pain relievers can help break cycles of fibromyalgia pain, relieve flare-up pain, and reduce muscle spasms. The muscle relaxant Flexeril can help reduce pain and improve sleep. Local injections of painkillers and/or cortisone at painful trigger points can be especially effective in breaking cycles of pain and muscle spasm. Treating insomnia from fibromyalgia. Insomnia is a big problem in people with fibromyalgia. Research shows that frequent disruptions in sleep prevent growth hormone, an important restorative hormone, from being produced by the body. Treatment and care. Fibromyalgia treatments work best, including treatments that target muscle pain and trigger points, treatments that help with sleep problems and depression, and treatments that help manage stress and anxiety. Get up-to-date information on the latest fibromyalgia treatments, from medications to ease pain, fatigue, and sleep problems to physical therapy, relaxation modalities, and regular exercises. Medications. Fibromyalgia medications treat symptoms, such as the deep muscle pain, sleep problems, anxiety, and depression. Cymbalta. Cymbalta helps people manage the unique symptoms of fibromyalgia. Physical therapy. Physical therapy is often recommended to help ease fibromyalgia pain and teach self-management skills. Learn more about the different types of physical therapy for fibromyalgia. Treatment for fibromyalgia. Medication treatments frequently help manage the pain and sleeplessness from which fibromyalgia patients suffer. However, the non-medication treatments are really the basis of treatment for fibromyalgia. The non-medication treatments for fibromyalgia include education, exercise, and stress reduction. An exercise program is crucial in the treatment of fibromyalgia and should include stretching, strengthening, and aerobic exercise. Many patients with fibromyalgia find it difficult to institute a regular exercise program because they feel they are too tired to exercise, and they may perceive that their pain and fatigue worsen when they begin to exercise. However, numerous scientific studies have shown that exercise for fibromyalgia, especially aerobic exercise, can improve pain, physical function, and a sense of well-being. Sleep disorders may require both medication and non-medication treatments. Stress reduction is important in managing the symptoms of fibromyalgia. Many patients feel that their symptoms are triggered by stress. Stress reduction can be challenging. There are many stressors in life. Chronic widespread pain in the muscles and joints, in combination with fatigue and poor sleep, lead to the consideration of fibromyalgia. A physician will perform a thorough history and physical exam to exclude other illnesses presenting with similar symptoms. There is no widely accepted blood test or X-ray test for fibromyalgia at this time. Any testing is done to exclude another condition. Tests for inflammation are generally normal in isolated fibromyalgia. Usually multiple soft tissue areas, fibromyalgia tender points, are tender to palpation. However, not all patients are tender at the tender points. In general, females are more likely to be tender at the classic fibromyalgia tender points than males. The new guidelines no longer require a certain number of tender points to be present to be confident that a patient has fibromyalgia. The new guidelines use pain and other symptoms of fibromyalgia to aid diagnosis. Patient questionnaires to assist in the diagnosis of fibromyalgia can be found online. There are both medication and non-medication treatments for fibromyalgia. Medication treatments frequently help manage the pain and sleeplessness from which fibromyalgia patients suffer. However, the non-medication treatments are really the basis of treatment for fibromyalgia. The non-medication treatments for fibromyalgia include education, exercise, and stress reduction. Sleep disorders may require both medication and non-medication treatments. Education about fibromyalgia is very important. Often patients have suffered with symptoms for years, and simply knowing why they have pain can be a relief, as many patients become anxious not knowing what is causing their symptoms. Patients should also be educated about treatment approaches, good sleep hygiene, and the importance of treating conditions that may contribute to their symptoms. For example, when a patient with rheumatoid arthritis has fibromyalgia as well, poor control of their rheumatoid arthritis may lead to worsening of fibromyalgia pain and sleeplessness. An exercise program is crucial in the treatment of fibromyalgia and should include stretching, strengthening, and aerobic exercise. Many patients with fibromyalgia find it difficult to institute a regular exercise program because they feel they are too tired to exercise and they may perceive that their pain and fatigue worsen when they begin to exercise. However, numerous scientific studies have shown that exercise for fibromyalgia, especially aerobic exercise, can improve pain, physical function, and a sense of well-being. Starting slow and sticking with the exercise program is very important. Low-impact aerobic activities such as swimming, water aerobics, walking, and biking are activities that patients with fibromyalgia find helpful. Many patients find it helpful to exercise in the morning. Some patients find yoga helpful for strengthening and stretching. This should also be accompanied by an aerobic exercise program. Stress reduction is important in managing the symptoms of fibromyalgia. Many patients feel that their symptoms are triggered by stress. Stress reduction can be challenging. There are many stressors in life, some can be changed and others cannot. Stress reduction involves a combination of changing stressors that can be changed and learning to lessen the body's stress reaction to the stressors that cannot be changed. Cognitive behavioral therapy is a form of psychological therapy whereby a therapist and patient work together to establish healthy patterns of behavior by replacing negative thoughts with more productive thoughts and actions. Acupuncture can be helpful for some patients with fibromyalgia but is not usually recommended as one of the first-line treatments for fibromyalgia because the scientific studies on acupuncture for fibromyalgia patients have not shown definite benefit. Likewise, trigger point injections can be helpful for some patients. Alternative medicines have not been proven to be helpful in fibromyalgia. While having a sufficient level of vitamin D is important to maintain bone health, a healthy immune system, and perhaps prevent certain types of cancer, Vitamin D supplementation does not improve fibromyalgia symptoms in patients who have sufficient levels of vitamin D. Narcotic pain medications should be avoided in fibromyalgia because they may worsen the underlying problem. Yoga. A regular yoga practice may help ease the symptoms of fibromyalgia. A 75-minute yoga class twice weekly for 8 weeks experienced less pain. Meditation. Believe it helps calm the mind and ease the body, promoting deep rest and relaxation, which help the body heal itself. Acupuncture. Acupuncture is an ancient treatment that uses very thin needles to ease pain and treat various conditions. They concluded that there was some evidence acupuncture may improve pain and stiffness. Tai Chi. Tai Chi is an ancient physical practice that involves moving the body slowly and gently. It has shown some potential in helping to ease fibromyalgia symptoms. Manual lymph drainage therapy. A type of massage called manual lymph drainage therapy, MLDT, helps move lymph fluid through the body. The lymph system helps rid the body of waste and toxins, but relies on muscle movement to remain efficient. Rhythmic movements can help stimulate blood flow, potentially loosening up lymph blockages that may be causing pain.